morning, Momi.
Good morning, Haley.
Today we're here in the IV room at Vital Healthcare, this office of Dr. Thomas Griffith, who is a naturopath in the Olympia area. And we're talking with Momi about her experiences receiving DMSO infusions for the treatment of rheumatoid arthritis. So, Momi, I want to ask you about your medical history and how you originally came to see Dr. Griffith.
I suffer from diabetes compounded by rheumatoid arthritis. A colleague of mine recommended that I come to see Dr. Griffith. She actually gave me his name and telephone number and said, contact him and he'll be able to help you.
Okay.
So here I am.
All right, so can you describe some of the symptoms for us of your condition and the degree of debility that they caused for you?
Definitely so. Swelling in the hands, fingers, wrist, elbow, knees, excuse me, and in the feet, ankles, debilitating pain, just amazing, to the point where I couldn't get up out of bed. Couldn't get dressed without assistance. The arthritis was had completely taken over my life.
Okay. So what kind of response and options did you get from your conventional practitioners that caused you to seek out alternative treatment?
When I went to my rheumatologist, they did blood work and took x-rays, and the x-rays said that I did not have arthritis. The blood work actually said that I suffered from arthritis, and the visual effects that you could see, my hands were 3 times that size. They prescribed prednisone and had me on steroids for 6 months, and I wasn't happy with that, on top of the fact that it complicated my diabetes. So I took myself off of prednisone and said I wasn't going to do it anymore because of the effects that it was having on my body. And my colleague continued to pressure me to see a naturopath, and like I say, she says, go to Dr. Griffith. He's the best that there is. Go see him. And that was over a year ago, so here I am.
Okay, great. So once you came in to see Dr. Griffith and he recommended these IV DMSO infusions, were you concerned about these types of alternative treatments, and what convinced you to go ahead and try them?
The alternative treatment, I think I was really ready for that after my experience with the steroids. But as far as my other concerns, yeah, I had huge concerns that I was doing something that was not very conventional. But and the other thing is when I found out that it was an infusion, that I would have to have needles done every time I came in, and I hate needles, just huge dislike for needles. But the alternative was that I was not going to get any better if I didn't do this. So I thought, okay, what's it going to do to me? Absolutely nothing other than to relieve the symptoms, and which is what it's done.
Okay, great. So can you describe your experience getting the infusions?
I guess at first it was a little scary because, again, the fear of needles. It's since benefited. It's just a slight little discomfort when it happens. Other than that, it's great. The benefits are great.
Okay. And these infusions are not covered by your insurance, so do you feel that the expense has been worth what you paid for them?
Definitely so. My insurance does not cover this, but to relieve the pain and discomfort, it's well worth the money, definitely. So when I first started, I was doing the infusion every week, and subsequent to that, we are now to the point where I do the infusion once a month. So it's progressed, but it's taken a little time in the beginning to get the inflammation down and to the point where it's really working now. And like I say, at first the pain didn't subside, but now it's working. This has helped me tremendously. Dr. Griffith also has given me a topical DMSO, and so when I have flare-ups in between my visits, I use the topical, and it brings instant relief. The smell is not so great, but it's short-term. And in the year plus that I have been coming, my husband has mentioned only once that there was a kind of funny medicine smell, but we get over that because of the benefits that it gives me. And I tell you what, I really, really recommend the DMSO, and I'm one of Dr. Griffith's biggest champions. I take his business cards all the time and give it out to anybody who has arthritis, who's suffering. And in fact, I gave one to a lady just the other day. She had back pain. She had arthritis in her back, and she'd had surgery 3 times and said she was through. She wasn't going to have any more, so I gave Dr. Griffith's card to her. And so she'll be calling then.
Excellent.
One thing, Haley, that I'd like to add is that I volunteered to do this, and I'm not being compensated in any way for sitting and doing the interview.
Thank you, Mama.
You're welcome.